New outbreaks of an old disease have recently popped up around the world. Monkeypox is a rare viral disease that's similar to smallpox. It manifests itself through rashes, skin lesions, and flu-like symptoms 1 to 2 weeks after exposure. The illness tends to be more severe in children and can be deadly if left untreated. The CDC is currently distributing vaccines to people at high risk for contracting monkeypox, and they recommend those with symptoms self-isolate at home. But the question that remains is how will the public adhere to these recommendations amidst growing mistrust in public health institutions?
Public health has taken a bit of a beating, I have to admit, during COVID, in part because our political leaders didn't always have confidence in public health. They denigrated public health science, and they gave public health institutions, frankly, a hard time. So they couldn't function nearly as effectively as they have in the past. And we're all going to have to work to restore the reputations and the functional capacity of these institutions, because it's not a question of whether there'll be another introduction of a new virus. It's only a matter of when and which virus.
That's Dr. William Schaffner, a professor of preventive medicine and infectious diseases at the Vanderbilt University Medical Center. He says that monkeypox is like many other viral diseases we've seen before, such as the Ebola and Zika viruses. However, the global impact of COVID-19, one that's still being felt years later, may have changed how we react to these threats. The medical community has become more vigilant in fighting traveling viruses, but they're concerned that the public isn't being cautious. Schaffner says this is because it's hard to grasp the threat of a foreign-born virus when it's seemingly so far away.
I think we as a society, whether our leaders or the average person, have struggled with this. It's difficult to understand that an exotic virus, COVID, starting in Wuhan, China, could come and run around the world and create so much, not only illness, but economic and cultural and social disruption. And here we have another virus, a very exotic virus that's being introduced. It doesn't appear to be nearly as dangerous, but nonetheless, it's spreading in our population. It makes you realize that we are a very small globe, and millions of people travel from one place to another, and they can be the vehicle of transmission of the virus around the world. The virus doesn't need a passport.
Unlike COVID-19, scientists have known about and studied monkeypox for years. 2 vaccines, as well as antiviral medication, are available to treat the disease.
Monkeypox is a rather exotic virus that lives in Central and West Africa. It's in rodents, small mammals, and it occasionally gets into primates. In fact, it got into a monkey and was first discovered in a monkey, and that's why it was given its name.
Although the virus is typically transmitted from animals, the most recent outbreak involves human-to-human transmission, and monkeypox spreads differently than other viral diseases such as COVID-19.
It is spread very, very slowly, and it is not easy to spread. You require very substantial, close physical contact to spread this virus. And so we can think of chains of transmission from one person to another, to 2 others, etc., rather than the bursts of transmission that we can have with COVID, which is spread much more by the respiratory route. So the public health authorities are trying to find all the cases, find everybody who is a contact, and keep them under surveillance to interrupt these chains of transmission that are occurring.
And though monkeypox isn't nearly as infectious as COVID-19, Schaffner hopes we can learn from the mistakes made during the pandemic. He says we should use that knowledge to protect ourselves in the future.
We have a short attention span, we Americans, and it's not always clear that we've learned our lessons and we do the right thing going forward. It's no guarantee that our public health infrastructure will receive more funding and support going forward.
According to Schaffner, public health should operate like a fire department. Although no one wants a fire in their home, we need a department ready and able to respond in case one occurs. With skilled and effective public health organizations, new viral threats can be quickly put out. The primary way to stay up to date with future illnesses like monkeypox is through updates by the CDC and World Health Organization. As Schaffner says, guidelines are subject to change as scientists learn more information about new diseases and how they spread.
Not only does information change when a new virus appears, we have to really train the public to expect that. We won't have all the answers on the first day because we'll be learning more as we go along, and then the messages will change. And that means everybody has to do their homework. That's hard. But the other thing is we need wise leaders. And in COVID, we had the political leadership and the medical scientific leadership in the same news conference saying diametrically opposite things within 3 minutes of each other. That was profoundly unwise, and we're living with the consequences of that today.
Schaffner hopes that improved communication between the public and medical community will help us combat future diseases more efficiently. You can find more information about Dr. William Schaffner on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Twitter, and Instagram. Our associate producer this week is Grace Galanti. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
Instead of anorexia, where people who are very thin or emaciated and see themselves as bigger, these are individuals who are quite muscular and they see themselves as too small.
The psychological disorder many bodybuilders view as an asset.
Then many men avoid yearly physicals because they say they're healthier than their peers.
But statistically, it's actually impossible for the majority of men to be healthier than the majority of men. So that just certainly can't be true.
All that and more on Radio Health Journal. I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
An estimated 100 million Americans were stuck in 100-degree plus heat. Shuttered schools, shuttered businesses, and sent electricity costs soaring as more people had to crank up their air conditioners.
The rising costs of more common extreme weather events. Then,
they're circular economies, but they also, while we're sharing our goods and services, we actually come to get to know the people who live around us.
How gift economies help the environment and Americans' wallets. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.